Okay, hello and welcome everyone to Portage Path's Facebook Live Pathfinder event today. We're here to talk about the expansion of our dual diagnosis program and introduce you to some of the members of the team. I'm Sean Blake. I am the Vice President of Outpatient Clinical Services, and just a side note, today is actually my 18th year anniversary here at Portage Path. So that's exciting for me. But I'd like to talk today about having our clinical staff discuss their programs, what they've done to build and expand our dual diagnosis programming and other group, and our overall goal, Portage Path's overall goal, to provide integrated dual diagnosis treatments to clients of Portage Path. First, I would like to thank the NSC Summit County Community Health Fund of the Akron Community Foundation for their generous grant, which is being used to expand these dual diagnosis programs. We here at Portage Path are sincerely grateful for the opportunity this grant has provided for expansion of dual diagnosis services that the community needs and allows us to continue, develop, implement, and expand innovative treatment in mental health and substance use disorders. For those of you who are not quite certain what does dual diagnosis mean, it essentially means that mental health and substance use diagnosis occur simultaneously, causing distress and symptomology, making it difficult for those we treat to manage their symptoms and function adequately in their daily lives. By using an integrative care approach, Portage Path is able to treat both mental health and substance use disorders at the same time, leading to improved care and better outcomes. People get better faster, really, by having it all in one program. Beyond that, we also do our best to link our clients to case managers to assist in meeting basic needs and primary care to assure that the whole person is being addressed and aided in the best possible manner. Through utilization of an integrated dual diagnosis treatment model, as well as trauma-informed care, we are able to really expand the work that we do and provide the best outcomes possible. Now, for those of you who aren't familiar with Portage Path, we have been serving Summit County community since 1971, with 2021 this year being our 50th anniversary. So that's a very exciting time for us here at Portage Path. We have outpatient clinics throughout Summit County, with the main clinic, which is the site of our current dual diagnosis programs, being here in downtown Akron. We're a full-service agency offering a wide array of services, including a 24/7 psychiatric emergency care through our emergency services, which also houses the local crisis hotline, which is tied into the national hotline. And we are now offering assistance with those affected by COVID-19 and the stress it has caused for many in the community. Additionally, as an affiliate of the Summit County Alcohol, Drug, and Mental Health Services Board, we are here to serve the most vulnerable and neediest in our community through sliding fee scale options for those who may be lacking health insurance or are underinsured. Additionally, we have grant monies that allow us to treat some with substance use disorders at very little to no cost. So with that, I'm going to move on and let some of my staff here, our staff here, talk about the programs that they developed, the expansion that we have really gotten in place here and have gone live either this week or into next week. So first I'm going to have Melissa Albert, she's an LSW, and Raquel Capon, she's an LPC, talk about Crossroads New Directions, which is our evening dual diagnosis IOP, and Avenues of Hope, which is a women's trauma and recovery group. So I'm going to pass this on to Raquel and Michelle, and they're going to talk about, Raquel and Melissa, sorry, and they're going to talk about their programs in particular. So go ahead.
Hi, Raquel Capon. As Sean said, I'm an LPC outpatient therapist here at Portage Path. I have been helping develop the New Directions Evening IOP, which is a dual diagnosis intensive outpatient program. We have developed this with a trauma-informed approach. We currently have it as a 9-week program 3 evenings a week, 5 to 8, and it's co-ed. We took this trauma-informed approach with the understanding that it really underlies many of the diagnoses we see presented, and it underlies substance use very often. So, well, first we would decide, we would assess each client that comes in, make sure that they have, they are looking for that appropriate level of care with an IOP, and engage them in the group, and hopefully an individual therapist and whatever case management needs they might have. The group, we tried to implement or incorporate CBT, DBT, evidence-based approaches while incorporating creative methods as well. Addressing the dual diagnosis physically, that psychosocial, spiritual model, and addressing all areas of one's life simultaneously. So the group, we introduced a lot of psychoeducation to explain, what diagnoses are, how the mental health and substance use interplay with one another, and how we can treat those things, as Sean mentioned, simultaneously. We, again, incorporate a lot of CBT, DBT. We have some somatic psychotherapy techniques involved, and we teach a lot of coping skills, which is essential for anyone trying to recover. Yeah, so the 9-week program would then, after we have completed that, there will be an aftercare offered as well, which will be a bridge to transitioning into life, and where we can see them implement some of these skills and reach their goals and find peace and live a happy life free of substance use, and reviewing relapse prevention, things like that, throughout the aftercare program. So that is something that we're very excited about. We started it this week. We're really excited to see it develop over time and offer services to so many people in need of these things in our community. And Melissa has helped co-develop that with me. And she also does the women's trauma group, which I will let her take from here.
Thank you, Raquel. One of the things that interested me into helping develop this program was the fact that it is going to be that trauma informed and also evidence-based, and we're looking at collecting the data to see the outcomes through use of the Cortana PCL5. So far, I've gotten good feedback, from the clients that have attended already, in the fact that this is trauma informed, but it is not trauma processing. We're going to use that teaching of those coping skills to manage those symptoms on a day-to-day basis as it appears today. So we don't have to go back through and relive that trauma or even process it during the group. There's going to be different pieces given to them that they can work on as an individual. So that they're going to be in a group, but it's going to be an individually based. That's going to be addressed through the individual treatment plans and the different marks there in the beginning, middle, and the end. And I think that through my work with the Avenues of Hope group, which is the Seeking Safety Women's Trauma Informed group, I've noticed that a lot of that success in that group is giving the clients the autonomy and the self-determination. They are committed to this recovery process, and I have found that once they are given those options and given through the Seeking Safety program, once they're given that autonomy of almost controlling their direction of their recovery, they seem to be able to embrace it more and to integrate it more into their day-to-day lives. One of the key pieces of that Avenues of Hope group is that commitment to recovery. And that's kind of basically a promise to themselves that they're going to do something within that week, because we meet every Tuesday. So within that that 7-day period, they're going to make a promise to themselves that they're going to do something that's going to forward them in their recovery efforts. It's really nice to see that there's, as this group has developed, there's this cohesion, and it's a supportive group. We emphasize that, you know, we want to hold each other accountable and responsible for your own recovery, but we don't criticize. There's this support that's built into this program. Seeking Safety is an evidence-based model. It was developed by Lisa Nahavitz. I can never pronounce her name, and I apologize. Nahavitz, back in like 2002, and it like I said, it's a present focused, where we take those coping skills and see how we can manage on a day-to-day basis those symptoms of not just the substance use disorders, but the mental health, the mental illness symptoms also, and it helps them to. I've heard a lot of feedback where it helps them to feel not so alone, like they have others that are going through similar things. And because it's present focused, we do deal with things that come up on a day-to-day basis, you know, anything from legal issues to involvement with children's services, you know, maybe medication monitoring, maybe something like that's not working. This program helps us to deal with those on a day-to-day basis and incorporate those coping skills. So in the evening program, that's something that I'm looking forward to implementing also, to have the clients have more of an accountability for their own recovery by putting those pieces in place, stating their goals. They're not our goals, they're their goals, and how we can work and give them those coping skills that they can use day to day. So.
And Melissa, how long has that group been running so far?
If I'm not mistaken, because of the COVID thing, it's been going for like a year, just over a year, I think. I know we had to suspend it during the COVID in the beginning, but yeah.
And I'm just going to kind of put you and Raquel a little bit on the spot right now. You know, Raquel used some acronyms that maybe aren't familiar to some of our audience, like CBT and DBT. And a lot of folks who may be watching might not know what that means. So can the two of you field that a little bit and talk a little bit about what CBT is and how it's incorporated, again, something brief, so that our viewers can, you know, have a good understanding of that?
Yeah, CBT, cognitive behavioral therapy. It's really looking at the thoughts, distorted thinking that can lead to behaviors. So we recognize the thoughts, change the thinking, change the behavior, and tying those to underlying core beliefs. So for example, let's say I'm having a thought that maybe I have social anxiety and I'm in a room full of people and my thoughts are, everyone's looking at me, I'm very uncomfortable. So I start feeling that way. And maybe I stop going into rooms full of people because my behavior is in response to those thoughts. So recognizing that maybe there's some cognitive distortions going on in my thinking, such as, well, I'm making assumptions or I'm jumping to conclusions, are common distorted thoughts. So I'm able to catch and correct that, okay, just because I'm thinking this feeling or thoughts, it doesn't mean that it's real. There could be all of these other things going on that I'm believing something that isn't true based on fear. So we start to catch that distortion, reframe it, and correct it. And over time, that leads to different feelings and different behaviors. So it really is addressing the thoughts. Okay, so just because these people are looking at me weird doesn't necessarily mean that I am weird, you know? And so I start going and taking risks more and changing the behavior. So I hope that was a good example. And so when it comes to mental health, substance use, that dual diagnosis, you know, there's often a lot of distortions going on in our clients' thinking. And so helping them to identify where they're having these distorted thoughts and how that's impacting their lives and their recovery, catching and correcting those things, and in turn changing their behaviors or their use or their isolation or whatever it may be. And alongside that, really exploring these core beliefs of feeling worthy. Maybe I'm thinking or not doing things because I don't feel I'm worth it. And so we tie that into it as well. And then DBT, I can let Melissa take the DBT. She's a part of a DBT consultation group we have. So I'll let her take that on for her.
Thanks, Raquel. DBT is dialectical behavioral therapy, and it was integrated or developed by Marshall Linehan. And it was developed first and foremost to address the special needs of people who have been diagnosed with borderline personality disorder because of the extreme emotional symptoms that they can encounter at times. So this program actually addresses like emotional dysregulation. Again, those coping skills, they integrate like the mindfulness things. So the DBT is really a foundation for a lot of these coping skills that we'll be, using in this program in the evening, the New Directions IOP, to help clients to understand. One of my favorite things from like the DBT model is no feeling is final. So to help them to understand that today is today, but we can move forward. And DBT allows us to practice those skills and to educate clients with these skills and to help practice them. And just like with the Seeking Safety model, that's on a day-to-day basis. That's not something that we have to go back in the past and bring stuff up to the future. We can use these skills today. Radical acceptance, those kinds of things are some of the examples in dialectical behavioral therapy. The opposites, do the opposites. So when we're dealing with somebody with a dual diagnosis, maybe there's something going on with the depression, or maybe there's a cue with their trauma experience that they're having, and they're experiencing a symptom because of that. We can use these skills, these coping skills that are being taught in this DBT to help them regulate that and be able to move forward from that. And that's something that they can use absolutely right here today, and start practicing it.
Thanks, you two. I appreciate that. Gave a little bit more explanation, talked about our program, why it's relevant and how it's important to the people that we serve here in Summit County. So thank you. With that, I'm going to move on to Nick Meister. Nick Meister is an LPC. He works out at our Barberton office. However, he is going to be doing our men's trauma recovery group called Roots of Recovery. And I think it started this week, if I'm not mistaken. So I'm going to give this over to Nick, and he's going to talk about the men's trauma and recovery group.
Yeah, so Melissa said a lot of it because the two groups are pretty similar. They're both based off of Seeking Safety, which, like she said, is very present focused and focused a lot upon how are we safely coping with what's going on in our lives, whether that is, a trigger or a flashback or something going on, or, the substance use piece. And the goal for the group is, to maintain abstinence from all mood altering substances. So the end goal is to get to sobriety and coping well with all of the ongoing pieces of mental health, which can be rather difficult because with the dual diagnosis piece, a lot of people turn to substance use to be able to cope with the symptoms of trauma and other mental health symptoms. So the men's trauma group, it did just start this week. One of the things that one of the clients said yesterday after group is that the group gave him a lot of hope that things can get better. There is a route for him for healing. So that was really good in the first group meeting to get that kind of feedback. But yes, very similar to Melissa, we're also going to use the core 10s to measure psychological distress, the PCL5s to measure the ongoing symptoms of trauma like hypervigilance, avoidance, intrusive symptoms like flashbacks and nightmares, just keeping track of it. And also, like she said, not diving into the past because we're not processing. We're just trying to cope healthily with those things. And I think it's definitely a good thing we split that into a women and a men's group, just because there are some pieces with men that trauma presents a little differently, that I think it's going to be good to have the space to address that My experience is that men with trauma typically tend to be really angry. In my experience, not always the case. So we're going to spend a good chunk talking about that anger portion and how that presents, and also some of the societal implications and stereotypes of men who are willing to be vulnerable. And I think that makes it very difficult for men with trauma to be able to talk about those things because we're not really taught that we can. So I think having that specific space to talk about whether, they're big T traumas, really severe things that have happened, or a bunch of little T traumas that have added up over time. They both have the same impact, just in varying levels of impact. So I think having a specific place for men to be able to talk about that and come together and find that group cohesion is going to be really effective, just like Melissa has seen with her women's trauma group. So I'm glad that we're able to offer this as well to men and address that portion of the population. And it's not necessarily something that everybody should dive into right away. We do make sure that the people in the group are engaged in individual therapy for additional support in case it's needed. And sometimes it's important to really have some of those coping skills down first, and individual therapy can offer some of that so that there's no diving in unprepared completely. So yeah, so the men's trauma group, we're up and running, started yesterday, meet every Tuesday from 12 to 1:30 around the same time as Melissa's, so that all of our clients can attend the other dual diagnosis programs as are going to be helpful for them. And I'm excited to keep it going.
All right, thanks, Nick. I think Nick brought up a very important piece too, which is the importance of having an individual therapist alongside the group treatment, especially for the trauma group. You need to be able to cope with some trauma. Again, it's not processing trauma, but you need to be able to cope with triggers and things like that as you are working your way through and improving your skill set, so that trauma is not as impactful on your life as you continue to grow and improve and move forward in your treatment. So, okay. Lastly, I'm going to talk a little bit about our family education and support group, also funded by this grant. The Family Education and Support Group is really designed for the family members of the clients of Portage Path Behavioral Health to improve their understanding of substance use disorders, of mental health disorders, of how they manifest themselves, of the recovery model, so that they are able to, be healthy supports for folks, but also have an outlet for themselves to talk about any types of concerns that they may have, and really better understand their loved one who has, the dual diagnosis, the substance use and the mental health piece together. And it's going to be offered free of charge. There will be no cost associated with that. The only criteria would be that you would, your family member, would be a client of the agency receiving dual diagnosis services here at Portage Path. And I believe that one starts up next week. I don't have the day and time in front of me. Maybe it's either Tuesday or Thursday at 5, I believe. But all of that's going to be on our Facebook page as well as our website, so that you can look and log in and see what we have going on here. So we're very excited to put that piece in as well, because it does give an outlet for families who sometimes feel frustrated, isolated, hurt, angry. There's a lot of stuff that goes into working with folks who aren't doing well and supporting them through their recovery. And families need support as well. So, we often do a lot of referrals to NAMI, the National Alliance of Mental Illness. However, in particular, this group is going to be important. This family education and support group is going to be important for the families of our clients here, to have an outlet, to have a place where they can get support, where they can learn about the disease process and the health issues and everything that goes into having a dual diagnosis here at Portage, in your life. So again, we look to continue to build and expand and grow our program so that it's not just designed for the people who we serve, but also for their loved ones and their support. So, A couple of other things I just want to let the community know that we do have in place here is that, oh, I just got a pop up here. Family support group. It begins next Thursday, February 11th at 6 o'clock, and it is facilitated by Matthew Reagan, who is unfortunately not able to be with us here during this event today. But just a couple other things that Portage Path has to offer, because, idealistically, we're going to treat, the whole person or make sure that they're linked to all the services they need. So where we will specialize in the dual diagnosis, which again is treating the mental health and the substance use simultaneously, we also like to hook them up with a primary care physician so that we're making sure that their medical needs are taken care of. Oftentimes with substance use and mental health disorders, there is also some physical comorbidities that go along with that. And by Portage Path having an access point clinic here in our building, it allows us to walk people right up, get them linked up to services in an environment that they're familiar with, so that we are able to, again, make sure that we are connecting, treating, integrating the whole person into care. That is the goal. That is what really generates the best outcomes and helps people to move forward more effectively. So, like I said, there'll be stuff posted on our Facebook page and our website, and I'll give you the address for that here in just a moment. But for those of you that are interested in referring people to our program, I know we have a lot of referral sources out there in the community who send folks over to us. If they're already an established client of Portage Path Behavioral Health, they're seeing, maybe a physician, counselor, a case manager, someone here within the organization, they can just be referred by any provider that they have here. So our providers are very good at recognizing the symptomology, as well as providing resources in-house that are able to complement the treatment so that they are able to recover faster. For those who aren't established with Portage Path, or maybe they were in the past, but their case has been closed, you can have them, or you can call, if you are indeed that person that we're trying to reach today, you can call our main number here at Portage Path Downtown Akron office. The number is 330-253-3100. And press extension 1701, and that will actually connect you with an intake, I forget what they're called now, someone who will gather the initial information and get you set up with your first appointment here. And they're really, good at getting folks in a timely manner and getting folks connected to the services here. Once you have your initial intake, what does that look like? That means it's a full extensive history of all the things that are going on with you from a biopsychosocial, spiritual perspective, so that as we work with folks, we are best able to refer them to the services they need, or at least offer those services and let them know that they're here and available. And they will also get you set up with follow-up care. Most of our group services, including our IOPs, and we do have a dual diagnosis general outpatient group. It's called Crossroads. Many of you in the community are aware of that. Most of our services can be accessed within a couple of days in terms of group services, as well as medication-assisted treatment for folks who are able to who are like an opioid use disorder and need that additional Suboxone or Vivitrol to help them manage the symptoms of withdrawal and managing opioid use disorders here. So, like I said, we have it all here in-house. I have a question up here that says, how many parents can participate in the family group? That is going to vary a little bit just because of space and COVID. Know that anybody coming into the clinic is going to be asked a series of questions around COVID potential or potential COVID exposure, have their temperature taken, and then the agency has put in place some protocols to make sure that we are operating in a safe manner that allows for minimal potential exposure to the pandemic and COVID-19. So all things that are very real to us in our world right now, all things that have been affecting people with substance use disorders and mental health disorders, all things that are really, designed to really improve the care and allow us to provide safe care here. So I can't really answer that question, how many parents can participate in the family group. It's really going to depend on size, but you can feel free to call us, to contact us, and we will certainly get back to you with some more information on that. And again, you know, as we start to wrap up our time, if you want more information on Portage Path, our dual diagnosis services, you can check out our website, which is www.portagepath.org. There's a lot of information on there. There's some client success stories on there, information about all of our programming that we offer here at Portage Path, as well as some more specifics about our dual diagnosis programming. And then you can also follow us on Facebook and Instagram to be able to, you know, see these same kind of updates. It's really cool. It shows up in your news feed and allows you to be able to, you know, really connect with people, be able to see what it is that we have to offer, and to, you know, really kind of get the ball rolling. So, you know, I'd just like to take a moment to thank everyone for logging in and watching us today and learning a little bit more about our dual diagnosis expansion. Again, thanking our funders, thanking our referral sources, thanking all of our clients for coming in and doing their best to get better. We are here for you. We're here to help you recover, move forward, and really get back to the best person that you want to be. So thank you everyone for logging in today, and this will become available on our website. So not too far down the road, this will be up on our website and you can watch it all you want. So, all right, thank you everyone. We appreciate it. Have a good day. Good luck to you all. Know that we're here for you.